afternoon, everyone, and thanks again for taking the time out of your busy schedules to join us today for the No Check Ask Medication Safety campaign. As you may be aware, the expansion of the No Check Ask campaign across health and social care will formally be launched this Wednesday, the 28th of September. So we hope this webinar will be a helpful sort of preparation really to allow you to begin to embed No Check Ask into your everyday practice from Wednesday. My name is Fiona Kirkpatrick and I am a pharmacist at the Department of Health, and I'm joined today by my colleagues Angela Carrington, who is lead pharmacist for medication safety across health and social care, and also Matthew Dolan, who's a pharmacy coordinator at SPPG. So we'll maybe just start with a little bit of housekeeping before we get into the detail of No Check Ask. So as Anya's already asked, if you could please add your name and organisation to the chat, that would be really helpful. And we would also like to record the session today for anybody who can't attend. So we'll maybe begin that now. And I suppose if anybody has any particular objections, if you don't mind just private messaging Anya, again, using the chat function, that would be great. So we would welcome any questions in the chat as well. So please type away any questions in the chat function and we'll do our best to answer them throughout. And if time allows, we would hope for a question and answer opportunity at the end. I will also share the Regional Safer Medicines email address should you wish to email any queries after the webinar. And if for some reason we don't manage to get to your questions today, we'll get back to you using this email address in the coming days. Okay, so next slide, please, Matthew. Thank you. So as always, we'll start off with our aim for today, so that's to improve the safe use of medicines, and that's through the implementation of the No Check Ask Medication Safety campaign, which aligns to the World Health Organization's Medication Safety Challenge, Patient Safety Challenge, which is medication without harm. Next slide, please. So in terms of our learning outcomes, we hope at the end of the webinar you will have increased your awareness of the WHO Medication Without Harm Challenge. You'll be able to outline our Northern Ireland response to that challenge, use the tools and resources to help support a medication safety culture, and to implement the values of the No Check Ask Medication Safety campaign really into your everyday practice. So as I mentioned, I'm a pharmacist at the department, and I'll be providing some very brief background and policy background on medication safety this afternoon before handing over to my colleagues Angela and Matthew for the detail of the No Check Ask campaign. So next slide, please. So we'll just start off with what is medication safety, and this is a question I'm sure we can all answer, but we know that every person around the world will at some point in their lives take or interact with medications, and that can either be to prevent or to treat illness. However, we know that medications can sometimes cause serious harm if they are stored, prescribed, dispensed or administered incorrectly, or even if they're monitored insufficiently. So medication safety ensures that medicines are prescribed safely, dispensed safely, administered safely and monitored safely. And we know it's not only those individuals that actually do the prescribing or administer or dispense, but we have actually many other staff groups who are directly or even indirectly involved in the medication use process. So these can include our healthcare assistants, social and domiciliary care workers, porters and medical secretaries. So anyone who really interact directly with patients and their medication. And I suppose one key message you'll see at the bottom of most slides is that we want to emphasize that everybody really has a role to play in medication safety. So next slide, please. So essentially, why does all this matter? And again, this might be a graphic you've seen before. We know that medicines are the most commonly used medical intervention in Northern Ireland, and at any one time it's estimated that around 70% of the population will take prescribed or over-the-counter medicines. While the systems in place within our health service ensure that the vast majority of medicines across primary and secondary care are prescribed, dispensed and administered safely, we know that errors can still occur. And this can result in severe patient harm, disability, and even death, as you can see from this slide. And this slide is based on a research study that has estimated that medication errors cost health and social care approximately £2 million annually. And those medication errors can consume over 5,000 bed days, and can contribute to over 50 inpatient deaths annually. And I know that we're all acutely aware that ensuring medicines are used safely is particularly challenging, and the medicines use process is highly complex, with so many multiple steps involved, right from even the decision to initiate treatment right through to ordering, prescribing, dispensing, administering and monitoring. And each step along that path is associated with a potential risk of harm, as mentioned. And as previously mentioned, our health service does have good systems in place to identify and help mitigate those risks and ensure patient safety. But we do know that both healthcare workers and patients can make mistakes, and often these mistakes are due to poorly designed systems, tasks and processes. And it's important to remember that I suppose, even though these mistakes can happen, it's important to remember that all medication errors are potentially avoidable and can therefore be greatly reduced or even prevented. Next slide, please. So you may be familiar with Medication Without Harm, which is the WHO's third Global Patient Safety Challenge. And this challenge outlines the vision and the strategic direction of what is really a global initiative aiming to reduce the level of severe avoidable harm related to medications by 50% over the next 5 years globally. And it focuses on evidence and research into why errors occur. And it takes the experience from other high-risk industries that errors are inevitable and often provoked in part by weak systems. So the challenge here really is to try and reduce the frequency and the impact of those errors. COVID-19 pandemic has, I suppose, significantly exacerbated the risk of medication errors and, I suppose, the associated medication-related harm. And it's in this context that medication safety was selected as the theme for World Patient Safety Day 2022, and the slogan was Medication Without Harm. So this really, again, highlights the importance of refocusing on medication safety, I suppose refocusing on medication safety, not just within Northern Ireland, but there's this refocus globally. We want to make sure we're playing our part in that. Next slide, please, Matthew. So then in 2020, Transforming Medication Safety in Northern Ireland was launched, and this is the Northern Ireland response to that WHO challenge, which some of you may be familiar with. And this plan was produced following formation of a medication safety task force, as well as significant engagement with workshops and roadshows with all stakeholders, and many of you may have been involved in those. So this stakeholder engagement included both healthcare staff and service users. And it was that engagement that was key to inform and shape the Northern Ireland response. So this strategy describes our key priorities, and as you can see on your screen, there's the Transforming Medication Safety wheel, and it has specific programmes for action for improving medication safety across 4 domains, and they are health and social care staff, patients and the public, systems and practice, and medicines. And this really is an ambitious but very important campaign to very important programme to improve safe practices with medicines and embed a medication safety culture within our population. So as part of this wider plan, that's where the No Check Ask campaign came from. And the intention of No Check Ask really is to address 2 aims within this strategy, and they are to increase the public awareness of the importance of using medication safely and to raise awareness among health and social care staff that medication safety is really everyone's responsibility. So that was quite a brief introduction to the policy side of things, but I will now hand you over to my colleague Angela Carrington, who's the lead pharmacist for medication safety across health and social care, who will be able to provide more detail on the strategy and the campaign. So thanks, Angela.
Thank you. And Matthew, could you just go back to the previous slide? Right, thank you. So yeah, so I'm lead pharmacist for medication safety through HSC, so I'm delighted to be here with you, and I'm actually going just to give you a bit of an overview of transforming medication safety in Northern Ireland. And as Fiona described, the WHO Medication Without Harm is a global patient safety challenge, so we are fortunate in Northern Ireland that we do have effective systems to deliver safe medication practices. And the WHO challenge provides us with an opportunity to realign our priorities to create that social movement for change, to enhance the care we provide to support even safer use of medicines. But ensuring medication safety is challenging because, as we know, it's multifactorial, multi-sector, multi-professional, influenced and impacted on by many, our patients, carers, staff, And we've all obviously got different needs, abilities and expectations. So as a consequence, this challenge is actually even more socially complex than the previous two global patient safety challenges, Clean Care is Safe Care and the Safe Surgical Checklist. And addressing complex problems really requires that systems level approach. So as such, we've modelled the responses Fiona's outlined on the 4 domains of the WHO challenges shown in the wheel. So I'm now going to briefly discuss each of these in turn and any developments to date. So next slide, please, Matthew. And this is a quote from WHO. The patients and the public are not always medication safety wise. They are too often made to be passive recipients of medicines and not informed and empowered to play their part in making the process of medication safer. So our aim is to really increase medication. Our aim is to increase public awareness of the importance of using medication safely, as everyone has a role to play to ensure the safe and effective use of medicines. And one of our key priorities is to deliver this public call to action, as Fiona described, based on the WHO campaign of No Check Ask. And Matthew will shortly discuss that in more detail. But we also recognise that in order to support our population to be medication safety wise, we need to establish that knowledge and understanding at an early age. So via the Pharmacy Skills Programme, we have produced interactive teaching resources which incorporates the No Check Ask campaign message using a health literacy approach. And we also want our people to be more involved in decisions about their medication. So we plan to adopt the WHO 5 Moments tool, which is an engagement tool that supports people to ask questions about their medication during the 5 moments when encounters often care with a healthcare professional. So that is at the moments when a medication is started, when it is taken, and when medications are added, reviewed and stopped. And we also recognise that we need to help people to report issues and concerns about their medication, so that as a healthcare system, we can understand medication safety threats better in order to really strengthen our resilience in the system. So this will be promoted under the auspices of a Northern Ireland MHRA Yellow Card Centre. And to help inform future work in this area, under this domain, we're also undertaking research led by the Community Development Health Network to discover those social circumstances behind unsafe medication practices and avoidable medication-related harm. So next slide, please. So healthcare professionals sometimes prescribe and administer medicines in ways and circumstances that increase the risk of harm to patients. So we want to raise awareness amongst health and social care staff that medication safety is part of their role. And that responsibility also includes reporting and learning from incidents, as well as learning from when things go right. Because in the vast majority of cases, things do go right. So we need to understand better how work is done in reality, rather than how it is perceived to be done. Because things do not go right because people behave as they're supposed to, but because people can and do just what they do to match the conditions of their work. And following a recent review of patients' stories concerning medication obtained from Care Opinion, we heard of several positive experiences of patients' interactions with healthcare staff. And I'm just going to read out one of those stories that really struck a chord with me. So one nurse, Arlene, spoke to me in a very kind and reassuring manner. She gave me painkillers and explained what I had to do to take them. She answered a few questions, and it was very nice to have a human touch and a feeling that she actually cared. And I think, and I think we can all agree really that every patient deserves that same experience. And whilst other factors such as work demand pressures may impact on achieving that, we really want all our health and social care staff to recognise their roles and responsibilities to support the safer use of medications. And our No Check Ask campaign encourages that. We also need to ensure that our staff are also medication safety wise. And that they have the necessary skills, especially as we advance the use of digital technologies. So we'll work with our universities and training bodies to incorporate the revised WHO Medication Safety Curriculum Guide and training programs. And we've already started on that journey in developing undergraduate interprofessional simulated medication safety education. We also recognise in order to progress, we need to facilitate new ways of connecting staff to share and spread best practice. And this, obviously, at this moment in time is an opportunity that we're also doing that, but we will encourage networks to apply the Institute of Healthcare Improvements, All Teach, All Learn philosophy to support people to learn and share, develop, test and implement new ideas to improve medication safety. So next slide, please, Matthew. And now on to the systems and practice within which we work. So systems and practice of medication are complex and often dysfunctional and can be made more resilient to risk and harm if they are well understood and designed. And to quote Professor Lucian Leap, human beings make mistakes because the systems, tasks and processes they work in are poorly designed. And this image presented was designed by the Institute of Safe Medication Practice in America. They adapted the hierarchy of control, which is used in other industries to eliminate or minimize exposures to hazards. And those controls at the top of the diagram are often the most effective, but they're the hardest to implement because basically they involve the forcing functions, automation, and then as the list ascends, they do become weaker, but they're also really the easiest things to do. So it's where we do tend to focus our efforts, maybe with standard operating procedures, education, learning bulletins, all things really telling us to be more vigilant. And really, we do need to keep in mind this diagram if we want to implement effective, sustainable change. So next slide, Matthew, please. So we've aligned within the domains of systems and practice the 3 priority action areas of the WHO challenge, and these are high-risk situations, transitions of care, and polypharmacy. So for high-risk situations, we want to support safer prescribing and administration practices across the HSE to help staff to get it right the first time. And we will do that through standardisation of practice, improved access to protocols and guidelines, and better communication between teams. And IT enablers are key to this. And this includes the Encompass programme with electronic prescribing and administration across all our trusts. And Optimise is now being used in primary care to support clinical decision making, and it aims to promote safer prescribing and improve patient outcomes through adherence to best practice. The top most commonly reported incident type in Northern Ireland is attributable to as an omission or delay of a medication as part of the administration process, and is a focus of many of the Trust's improvement work. So to strengthen this, we do plan to undertake a targeted improvement programme to reduce the number of inappropriate omitted doses within our hospitals and care homes. As electronic prescribed administration will initially be implemented in the hospital sector, we plan to extend the standardisation of our secondary care prescription administration document to our care home settings to help improve and standardise medicines management practices. Initial work in this area has begun and is being overseen by the Regional Cardex Working Group. And many prescribing incidents in Northern Ireland are attributable to systems failures during transitions of care, often due to communication failures. So we have systems for MedRec in primary and secondary care, but our challenge is to ensure that we have a reliable system whereby every patient, every time, has their medication reconciled when transferred between care settings. So the plan is to develop a coordinated approach that is aligned to NICE recommendations. The prevalence of polypharmacy in Northern Ireland continues to increase with our ageing population, who are also suffering from multiple long-term conditions and frailty. So we will work to reduce inappropriate polypharmacy by ensuring that all patients who are at most at risk of harm receive at least an annual medication review. And Northern Ireland, via the Medicines Optimisation Innovation Centre, is currently involved in a 3-year EU-funded Interreg project called iSympathy, which is focused on management of polypharmacy and adherence. So this project is running until March 2023, and it aims to develop and embed a whole systems approach towards medication reviews that is scalable. So next slide, please. So the final domain of the WHO challenge is focused on medicines. Medicines are sometimes complex and can be puzzling in their names or packaging, and sometimes lack sufficient or clear information. Confusing look-alike, sound-alike medicine names and/or labelling and packaging are frequent sources of error and medication-related harm that can be addressed. And also some medications are associated with a greater risk of harm if used inappropriately, and these are often cited in incident reports and in the published literature. So we plan to undertake a targeted improvement programme with the aim of reducing preventable harm associated with insulin, anticoagulants, opioids and NSAIDs. And as mentioned in the WHO quote, we need to develop strategies to prevent the occurrence of incidents involving look-alike, sound-alike medicines. And this requires us really to build good practice and medication safety into the supply of all medicines. So this also includes reducing omissions and delays due to medication shortages. And digital solutions, as they advance, will also have support with electronic transfer prescriptions in primary care, and that will also help to avoid those unnecessary delays. And when we supply medications to patients, it provides us with an opportunity to ensure really that the patients are taking high-risk medicines, of those, that they actually receive the advice and support that they need to reduce the risk of harm. So risk stratification tools now exist, which can be used to help us target those patients with the greatest need for our input. And finally, supporting patients to take their medications as intended is the final step to ensure the safe use of medicines, as it can prevent significant harm and suboptimal clinical outcomes. And evidence tells us that 10 days after starting a medicine, almost a third of patients are actually non-adherent. So work is underway to develop services that provide adherence support arrangements for patients, developed in conjunction with community and GP practice pharmacists and trusts. And my next slide, please. Thanks, Matthew. So this is an ambitious programme of work, and to help inform its implementation, we held a medication safety workshop in June with senior leaders across the HSE to help inform our next steps. So we're in the process of formulating that plan and creating the infrastructure to support its delivery, which will be overseen by a regional Safer Medicines Oversight Board. Co-design and co-production is core to transforming medication safety in Northern Ireland. So we will continue to engage with staff and service users in its ongoing implementation, as really achieving success really requires this social movement for change. So I'm now going to hand over to Matthew to present the No Check Ask campaign, which is really also is part of our journey in this social movement for change for medication safety. So thank you.
Thanks, Angela, and thanks, Fiona, as well. So my name is Matthew Dolan. I'm a pharmacy coordinator at the Strategic Planning and Performance Group at the Department of Health, formerly the Health and Social Care Board in Old Money. So I'm just going to give you a rundown of what No Check Ask about, give you some practical tools that you can use and go away with. Realise there's a very diverse audience on here, which is really good. I can see people from nursing homes, I can see people from primary care, GPs, pharmacy, I can see people from private care as well. So hopefully everybody can take something away from it. There's something, maybe if you work in the communications department, you'll take away from it. Maybe if you're designing resources, you can take away from it. But equally, if you're working on the ward, if you're working in a clinic, as you can see, somebody has just come from a clinic, no need to apologise for that there. You'd also get something out of this, so something for everybody in it. Where does No Check Ask come from? So it's been referenced quite a few times already, medication without harm and the World Health Organization. You can see up on the top right corner of this screen, the No Check Ask, and our logo looks slightly different. What we've done with that, we've taken that and we've made it into a Northern Ireland version and something that can relate to us. No Check Ask for a worldwide campaign is great. It is a worldwide campaign, but we want to make it local. And you can see the World Health Organization also has a version of our strategic framework, which is passed on to us as well. So what is No Check Ask anyway? So the No Check Ask medication safety campaign is targeted at healthcare staff and patients, and that's the important thing. And it's all healthcare staff, as I said, diverse there. It's unfortunate I've just realised today that there's 3 pharmacists presenting, but that is not by our design. I think that's just the way it's worked out from our team. But it's great to see so many different professions on here, and that is important. The campaign promotes use of a 3-step check to help increase awareness of and educate the public and healthcare professionals about the importance of using medication safely. It will support people to be more involved in decisions about their medication and encourage them to report issues and concerns about their medication. And again, everyone has a role to play in medication safety, from healthcare professionals to patients. So I'm just going to play a short video here, a short animation that will help explain it more. Just bear with me here.
In Northern Ireland, we are fortunate to benefit from effective systems for the safe prescribing, dispensing and administration of medicines. And that means that medication safety is a top priority for everyone in health and social care. However, we know that errors can still occur, and we're committed to supporting improvements that aim to prevent the risk of harm to patients. We can support the safer use of medicines by using a simple 3-step approach. Know, check, ask. Know the medications you are prescribing, supplying or administering. What do they do? What benefits do they have? And what are the side effects? Check that they are right for each individual patient, based on their health conditions and any other medications they are taking. Use the 5 rights of medication safety: right patient, right medicine, right route, right dose, and right time. Ask a colleague if you need to clarify anything about a patient's medication or condition, or think something is not quite right. Ask the patient if they understand the information you have given to them, and suggest that keeping a list of their medicines can help them. Everyone has a role to play in medication safety. Know, check, ask. In Northern Ireland.
So that's it in a nutshell, what no check ask is, and hopefully it's not dumbing it down too much for people who are working in healthcare. It's a simple message. It's part of much wider things. It's not just the thing that's going to crack this nut on a open or whatever once and for all. I was doing some of the calculations this morning when I was going through the slides, and there's 43 million prescriptions in primary care dispensed every year. Probably each one of those is maybe 30-40 doses on that there. So that's 1.5 billion doses every year are administered, and most of them, the vast majority, go without hitch. So when you look at it, that there's maybe 11 million errors, that's a very small proportion. Already today, there will have been about 200,000 doses of medications given in Northern Ireland, and the vast majority have went without hitch. What No Check Ask is doing is to try and improve, try and increase the number that go to plan, and that the patient understands and the staff understand. So that's really what it is. It's not trying to complicate things, it's just putting an extra check in place. So what is about this poster that's up here at the moment? This is the patient-facing poster. You'll notice that when you look at the campaign resources, there's a very similar look between the staff one and the patient one, but there's subtle differences. So this one's got the patient on it, and we're asking that patient to know each of their medications they're taking and how to take them. Ideally, keep in mind medicines lists so there's a clear record of the medicines that they're taking. So I'll come back to that later. And check they're using their medications in the right way. Always follow directions on the medication label. Always take the medicines the right dose and at the right time of day. And always read the information leaflet, and never share those medicines as well. So different parts of this will come out over time, and we'll focus on different parts of that as different parts of the campaign come out. But at the moment, it's the no check. And then finally, it's the ask. Ask you guys, ask your healthcare professional, your doctor, pharmacist, or nurse if you're unsure about your medicines. Never stop or reduce or increase your medicines without asking. And we have had queries from some, they're a bit worried about this, are they going to get inundated with people asking? And that's not the design of the campaign. The design of the campaign is to prompt them. So for example, if they're prescribed coamoxiclav and they go, do you know what, somebody once told me that I was allergic to that, I am allergic to penicillin, is that okay to take? It's that kind of questions. Is it okay to feel, I feel a little bit sick after taking this medicine, is there a better way to take it? So it's those kind of questions we're encouraging people to ask, encouraging the patients to ask. Then on the other side of that, or complementary to that, is this staff resources, and they'll have a slightly different thing. The patient's still obviously at the centre, but around that there are all the healthcare professionals that are working with, and health and social care professionals that are working with those patients as well. And the message that, again, is that simple message of no checking and asking, but flipped a little bit in its head to cover more from a healthcare professional or a carer's point of view. And it'll mean different things to different people. And it needs to sit in an operating theatre, will have a different take on no check ask to somebody administering medications in a nursing home or to a patient in their own home. Slightly different, but everybody can still apply this no check ask. So for us as healthcare professionals, we want to know the medications we're prescribing, supplying or administering, what they're doing, what benefits do they have, and what are the side effects. Then on top of that, we want to check that they're right for each individual patient based on that patient, on their health conditions and any other medications they're taking. And it was referenced there in the animation, using the 5 rights of medication safety is a useful tool to check. It's an additional to the no check ask. It's the 5 rights of medication are have I got the right patient in front of me? Is it the right medicine in my hand? Is it going to be given by the right route? Have I got the right dose? And is this the right time? And that can be applied to many circumstances. And then finally, we want to, very importantly, ask a colleague if you need to clarify anything about a patient's medication or condition. And that can just be turning around and getting one of your colleagues beside you to just double check something, or it can be getting on the phone and asking a pharmacist. It can go and asking a colleague, a more senior colleague as well. Another part of ask that we want, and this is actually beyond what the World Health Organization asks for, ask the patient if they understand. That's another check. Ask if, do you understand your medication? Do I have this right? Are you the right patient? So it's another ask in there. So no check ask. So we have run No Check Ask. We've been running it now for about 6 months because it started out aimed at the patients through the Living Well campaign in community pharmacy. I'm going to just hand over here to, via a recorded video of Richard Cregan, who's one of our community pharmacists, who's going to talk us through how it's went in community pharmacy so far.
Community pharmacists are medicines experts. We dispense prescriptions, deliver a range of clinical services, and provide advice on treating everyday health conditions. Our pharmacy team, like many across Northern Ireland, took part in the No Check Ask campaign as part of the Living Well service. This is a 3-step checking system to support people to use their medicines safely and feel confident. Patients were asked to know your medicines and keep an up-to-date list, check that you are using your medicines in the right way, ask your healthcare professional if you're not sure. Patients found the My Medicines List leaflet used in the campaign to be a helpful way to record their current medicines. Patients also appreciated the key safety tips, such as not sharing your medicines with others, reporting side effects, reading the information leaflets which come with their medicines, and of course, remembering that if you have questions, your pharmacist will be happy to help. No Check Ask. Everyone has a role to play.
So thanks to Richard there, and also thanks to all the No Check Ask talking heads, as we call them. We've a number of resources that have been recorded for community pharmacies, in GP surgeries, in the trust as well, just recording various people who help out with, or various professionals who are involved in medication. So if you're on screen, I can't see everybody, but thanks to anybody who's also in attendance at the meeting here today at the training. So where can you find things? Some of you will have had hard copy resources arrive in the post. It's tailored to the location, so most places should hopefully have got the leaf or the poster with the 3 members of staff in that. Out to everybody, then there'll be tailored resources sort of for the patient. Another poster, the My Medicines list will have went to certain places, so will have gone to GPs, will have gone to community pharmacy. Down at the bottom right there are stickers the community pharmacy will have got, No Check Ask. The idea of those is to stick them on patient bags. I think some of the trust pharmacies got those as well. And then there's the very last one there going right round is before you take it is a counter map which was designed for community pharmacy. If you do need any more resources, just email medicine.safety@hsc.net and we'll be able to help you out. We have some spare resources, and if we get enough demand, we will circulate more of those as well. So if you've got the hard copy resources, you should have got them. If you haven't got hard copy resources and think you should have, if you're working in GPs in particular or trusts, again, email medicine.safety@hsc.net and we chase up where they are, whether you should have got some. Online resources, the easiest way to find your online resources is to probably just stick in Google or whatever your search engine is, No Check Ask NI, and that will bring you fairly to the page up the top list. The web address is up there as well, https://online.hsc.net, but as I say, searching for it's probably the easiest way. Also, all the resources have a QR code on them. If you scan that will take you to it as well. It'll take you to the patient landing page or the staff landing page. When you get the patient landing page, you'll see that logo at the bottom. If you work in healthcare, click here, just click on that and that'll bring you more bespoke to the resources that you're looking for. Patient leaflet, I'm just going to focus on here, which is the My Medicines list. The My Medicines list is a list of all the medicines and supplement a patient takes, and it's for patients. It's been designed for patients to complete. The reason for that is we want patients to sit down, take out all their medicines, take out all the prescriptions, take out all whatever they have, and go down through it and actually complete it themselves, because that's how they learn about how they know their medicines, how they check, how they take out the leaflets, and how they then go and go fill out their list and then take it to someone and go, I need to ask you about this because it's not quite what I thought. I thought I was supposed to take this in the morning. Turns out I should be taking it at night. Is that bad? Is it good? Is it harmful? And that's the purpose of it. So we're encouraging everyone who takes regular medicines to keep an up-to-date list of the current medicines and to take it to all healthcare appointments. And it can be either themselves or a family member or caregiver. This is the reverse side of it. Hopefully you can see it there. It's the My Medicines. It's very simple. I'll demonstrate it more in a moment on the online version. And it's about keeping an up-to-date list. to help them know their medicines and help when they're discussing with a healthcare professional as well. It's very easy to get lose track of your medicines or forget something. I will say one thing about it is if you are working in healthcare, particularly in the trust or anywhere where you're doing medicines reconciliation, it is another resource. It has been completed by patients, so you need to be aware that to double check that with other sources as well. In saying that, it's probably a very good source because it probably is going to tell you how the patient is actually taking their medications as opposed to how we think they're taking their medicines. So if it does say, oh, they're taking that at night time, but they shouldn't be taking that at night time, you can immediately pick that out because they've put that in there. So it's a good resource for medicines reconciliation, but it's not the only resource and it has to be taken with that caveat that it has been completed probably by a patient. There's an online version as well. I'll demonstrate that shortly. So the online resources, I'm going to attempt to flick over to them here very quickly. So if you've done your Google, you'll have come to this page. You'll have come to No Check Ask. If you work here in healthcare, there's your resources. You click on that. Where you land first is the patient page. You get an animation. It's similar to the animation I've just shown you, but it's actually aimed at patients, so slightly different message. We have a service user, Eve Brooker, who's been very helpful with her design of these resources and has also very kindly recorded a video of herself explaining what it is, why No Check Ask is important, and what patients themselves can do, and why she uses her my medication list. We've got links to social media, and we've also, very importantly, because a link at the bottom there to volunteer opportunities. So we have Eve who's supporting us, but we would like to see more involvement from patients. So if you do know any patients, again, let them get in touch. There's a contact email address there, and it's the same one, it's a generic one, medicines.safety@hsni.net. We have Staff Zone, which is more aimed at education. We will be working more on this and populating it more as the campaign runs. So you have our animation. There is a slide deck there. It's not this slide deck that we're doing today. It's actually a slide deck that you can take, download, and use in your own presentations about medication safety and particularly about No Check Ask. We have our talking heads there, which will be used throughout social media, but you can use them in your own social media as well, and also the contact details. And we've also campaign resources. I've been asked already online there, where do you get the background? Somebody, one of my colleagues, Sam Barma's got a background behind her with No Check Ask. Where do you get that? And you can get all your resources here. So you can get sort of hard copy things, my medicines list, the posters, the leaflets, but also you can get social media kind of things. So you can get GIFs. If you know what a GIF is, you know how to use that. If you don't know what a GIF is, you're probably like me and we'll just ignore that part of it. You can also get the logos and things to download there and all the resources. And yes, if you need a background for your Zoom, that would be really great to use these resources. We'll probably add that shortly because somebody has already requested that as we're speaking there. Going back to the main thing, was the My Medicines list. It has its own section on here. So you have the hard copy version. If you're working in primary care, certainly you'll have been circulated some of those already, a supply of those. But patients have been asking, where do we get one to fill in online? And you'll get those on here as well. So you get that is just a PDF version of the one that's been posted out. But you'll also get a Word fillable form, which will just open. And then it's just a matter of the patient filling in themselves. So you can see how easy it is to fill in there. They just enter the date of birth. Don't know Homer's date of birth, but we'll put a random one in, and then they'll probably filled it in today. And it's very easy to just add in drug, omeprazole, 20 milligram. We're to take one of those every day, take it in the morning. Do I take it every day? Yes, I should be taking that every day. Why do I take it? I take it for my tummy. And it's a pink tablet. So it's for patients to fill out again. Some patients will like this version, some patients will prefer the handwritten version, some people will prefer the back of a cornflakes pack. We just want them to keep a medications list. That's what we want them to use. This is the online resource, and these are resources that we would really like them to see them using. So simple to use, and there's online versions there of them as well. just jumping back into the presentation. So now run through those. That's basically has worked okay. I think a quick run through of the online resources. Look on the website and you'll find those. Like I say, just Google No Check Ask NI and you'll find all those resources to use. Spread the No Check Ask message. We want to see that logo as much as possible. We want to see it in posters and leaflets, used in your email footer, using social media. You can get all those resources, like I say, on the website there. If you want a high-res version, high-resolution version, contact the team again, and we'll get you the right resource to use for that. We would like to use it. We've already seen it used on a number of trust resources, and it looks very effective. If you're not sure if it's the right message for your resource, just drop us a line and we'll okay that. We would say that if it's for use within the HSC, it doesn't need permission, but if you're not sure, just ask us and we'll have a quick look at it and give you input on that and maybe get the right resource for you. Some other resources that are available. We have our formulary, Northern Ireland formulary, that you're probably familiar with. It's got a patient zone within that has got some more bespoke information about particular medications on it. If you want to see the 5-year plan for transforming medication safety, you'll find that on the Department of Health website. And also then on the WHO website, if you Google medication without harm, you'll find that and the WHO plan. One resource I did want to highlight though, in addition to that there, particularly if you're working in pediatrics or with children, or actually it's a good resource anyway for anybody to use, is the Pharmacy Schools program. And you can see they've actually got some colouring in with the No Check Ask in it there as well. So if you're looking for something, if you're going out and doing education sessions, particularly with schools, go onto that and you'll be able to print those resources off. Social media, again, if you're into social media, you know what this is. It's a No Check Ask HSCNI hashtag, hashtag No Check Ask, hashtag medication safety, and hashtag medication without harm. So again, it's about spreading the message as much as you can. So that's really it. No Check Ask.